think one of the biggest paradigms we're seeing in heart rhythm monitoring and arrhythmia core lab adjudication is that in the past, clinical trials and clinical studies in arrhythmia and heart rhythm disorders used to assess events on a periodic basis. For example, atrial fibrillation trials often assay the first event of atrial fibrillation that develops. I think we're moving away from that. We realize that heart rhythm disorders have a 24/7 impact, and so knowing the overall burden of an arrhythmia that the patient has is really important. And when you add things in like continuous monitoring, there is the added complexity of how you interpret the data, how you adjudicate the data, and doing that in a cost-responsible fashion. And so I think that's an area where we're particularly interested in blazing best practices for future clinical trials, not just for tomorrow, not just for next year, but 5 and 10 years down the road.